everyone. I'm Sue Paul, Senior Director of Wellbeing and Brain Health for Asbury Communities. May is Mental Health Awareness Month. With me today is Dr. Karen Miller, Senior Director of Brain Wellness and Lifestyle at the Pacific Neuroscience Institute Foundation. So, welcome, Dr. Miller. So nice to have you here today.
Thank you, Sue, for having me. I'm excited to be with you today and to share with your audience.
Oh, that's awesome. Could you just go ahead and tell us a little bit about your background and why I
Sure.
have you here today?
Absolutely. So, by training, I'm a geropsychologist and a neuropsychologist, and I was on faculty at UCLA Medical Center for more than 2 decades. And my focus has been research in terms of aging and brain wellness. This is focused on both preclinical markers that tell us who might be at risk for cognitive decline, including mild cognitive impairment or dementia. And then also, I have focused on creating interventions, predominantly cognitive training programs for those who are experiencing normal aging, mild cognitive impairment, or some type of dementia, specifically Alzheimer's disease, or for those who are the care partners of people with dementia. So, my background is both clinical and research in this field of aging. And of course, this is one of our largest growing populations in the country. So, for me, it's an exciting time in our country because we have more people than ever to serve. And so I'm eager to share with you and everyone today about some of the mental health components to aging.
Oh, well, this is perfect because, as I said, May is Mental Health Awareness Month. And I think, with the older population, we have to approach it a little differently or be a little bit more informed
Yeah.
because it can vary, against different populations. So let's start with this. For the aging adult, how might depression present differently?
Yes. So what I think we are in our younger years, we think of depression as maybe we're really sad or that we're crying or we're really, I don't know, sometimes not even leaving the house or doing less things with our friends. But with the aging population, we have to think of depression as sometimes presenting more in a somatic sense, meaning that our body is affected. So we might have more headaches or body aches. We also might feel that we're just withdrawing or less interested in life. And then, of course, being my background, we can't ignore that there may be cognitive symptoms that first emerge that actually indicate that there's depression. And what I mean by that is someone may feel as if they are more disorganized than they used to be, or they might feel that they are having more forgetful moments, but it might actually be tied to their mood. And so those can be confused for both the individual, but for the family and even for the primary care doctor in terms of what are the presenting symptoms. Is this depression or is this cognitive decline or is there a combination? I think the one that stands out to me over the years is when people notice this new symptom and they say, this is really not like me. And they're not sure what it's connected to, but underneath it might be depression or stress or anxiety.
Yeah, that's a really good point because that's somatic. Those somatic symptoms can also just lead you to believe it's something else,
Oh,
maybe
absolutely.
so it could mask, that the fact you're even looking at depression as a cause of the symptoms because it could be other things too.
I
So
think
maybe
that's a
easy to
good point,
dismiss.
though.
Yeah.
So, because like that masking, people start to really worry about their health.
Hmm.
And so they might have a lot of health anxiety, but they might not have anyone actually looking at it from another angle to say what's actually going on with your mood versus your actual physical body as well. So, of course,
Hmm.
we always want them to investigate their physical symptoms, but also we want to have a greater awareness of those cognitive and emotional symptoms that might be the primary cause.
That present as something physical. That's
Yes,
that's really interesting.
absolutely.
So this is a question I get a lot. So I'd love to hear your take on it. But when are cognitive complaints part of normal aging? And when could it possibly represent something else like MCI or dementia?
Yeah, well, that's probably one of my favorite questions, right? Because that's often on everyone's mind. And honestly, I think people by the age of 50, certainly by 60, are asking themselves that question, right? Like, oh, I was just forgot a word or couldn't remember a couple details from a conversation, or maybe missed an appointment, and people begin to think, oh, is there really something wrong with my mind or with my memory? And so we do have the challenge of figuring out, when is this just part of normal aging? When is this also maybe temporary due to stress or real busyness in our lives? And when is there a sign that there may be something that we should have investigated further? And so I think what really helps is to first relax and remember that everybody is aging, right? And that even people in their 40s begin to experience some mild word finding difficulties here and there. But it is normal to work around that or to search and find a different word to substitute in. But it's when we are forgetting more specific information. So, like, let's say people are forgetting names of objects. That's different than if we're searching for, let's say, the name of a movie star, or we are searching for a particular adjective that we think describes the situation best. So when there's a little bit of word finding difficulties, it could be normal aging, but when it's actually objects or names of things that we should know very well, and it doesn't have to be words, it wouldn't be words that, we don't use frequently, but I'll give you an example. Like if we can't remember the word hourglass, no big deal. We don't use that word very often. But if we don't remember the word stapler, which would be a very obvious one, then we might think, huh, that word has always been easy for me. Why am I struggling now to find that noun? So that's one aspect, is language. The other aspect, which we talked about earlier regarding in the mood symptoms, is also that organization or executive functioning. So when things become more challenging to organize or make decisions or put together a plan, that may be a symptom that this is more than just normal aging. And especially if it persists and it progresses and it seems worse or it's interfering with our everyday life. So, an example would be if you have always been good at planning trips and all of a sudden it becomes so cumbersome to plan a trip, and this feels like a very different symptom than it has in the past. That'd be different than having just a bad day and saying, I don't have the wherewithal to plan this trip today. I'll set it aside and I'll do it on another day. But if those type of usual skills, routines, or habits become more challenging, then it might actually be a symptom of mild cognitive impairment. So, in addition to language and executive skills, the third one, which is the obvious one, is memory, right? So, it's natural for all of us to forget some details from conversations we might have with friends, to sometimes once in a while overbook ourselves or to double book ourselves or get so involved in an activity that we don't go to appointment. But when that becomes a pattern of forgetfulness, then we want to look at it beyond normal aging. And I feel that it's helpful to just take a notepad and sort of record some of these moments and then just see how they're adding up over the weeks or the months, and not letting it go too long before you actually ask your physician for a quick checkup, which in these days you can have a 5 to 10 minute test by your primary care or by a psychiatrist, a neurologist, a psychologist, a therapist. Um, and even our occupational therapists, even some of our physical therapists are very comfortable with this 5 to 10 minute screening. And that can just give us at least a clue if we should pursue further testing or
Mhm.
investigation.
Thank you. Very, very helpful. So let's say I'm an older adult with a history of depression. Does that affect my aging process, or, are there other presentations I might show just by having a history of depression?
Yes, so this is a complicated area of research, and some of our leaders in the country in this area of research are actually at UCLA, including Dr. Helen Livretsky. But what we know is that if you do have a history of depression, you might be at higher risk for depression again later in years, and you might be at higher risk for cognitive decline. But the good news is that if you have sought treatment, both by therapy and or medication, that risk goes back down. So that's a really important component of this month of mental health awareness, because if you are not yet experiencing the aging process, but you're dealing with depression or anxiety or stress, it's really important to seek some type of help, right? And there's a variety of types of help out there, But the reason why we say that is we don't want this to be a risk factor that later then has to be considered in your aging years as a potential for cognitive decline. So whether we are in the younger end of things or in the aging end of the spectrum, we want to address depression, anxiety, stress, apathy, because it could put us at risk for additional neurological changes.
Hmm. Okay. You sidetracked my brain with the word you used, apathy.
Yeah,
Um, could you just expand on what apathy is? I think a lot of people encounter apathy maybe in caring for somebody that has depression or dementia, and it's a really challenging symptom. So
absolutely.
can you
And
explain a little bit about what that is?
sure, apathy is a disinterest, your inability to engage at the same level that would be at your normal level. So we all have different levels of energy and engagement in this world, right? Depending upon what drives us, what interests us. But when we are withdrawing or pulling back from what we are typically interested in and maybe feel responsible to do, and that's shutting down, that's apathy. So that level of disinterest could actually occur at any age. I mean, you could be 5 to 95 and experience apathy. Right. And it might be short-lived or it might be longer-lived. But you mentioned something very important, Sue. And I think at Mental Health Awareness Month, it's very key for us to think about our care partners. And what I mean by that is for everybody out there who's caring for someone of any age who might have physical or mental health challenges, then often the care partner is at high risk for depression or anxiety or apathy. And so we want to be sure that we address what their needs are too. And sometimes when you are the care partner for anyone, and it could be a child, it could be a young adult, it could be an aging adult, it could be your spouse, it could be a family member or a neighbor, then, sometimes it's the hardest to ask for help for yourself or to engage in self-care because you feel like you're really on. You are so necessary for their medical, social well-being. But we really do need to take the time to pause and think about what do you need for
Yeah,
your mental
that's a
health.
great, great, great reminder. All listeners out there, I want
Yes,
you to pay attention to the care partner too, because we need them, first of all, but they are really
yes,
under a tremendous amount of stress. And
correct.
and sometimes people just aren't looking at them. They're looking at the person being cared for, and their care partner's not getting that attention they so desperately need. So
Right.
great reminder. Thank you.
Yeah, absolutely.
Okay, so circling back to depression, I
Yes.
had some questions about some non-pharmacological approaches to managing
Absolutely.
depression.
Absolutely. Well, it goes without saying, I am a psychologist, so I do encourage people to think about whether therapy is the right option for them. And sometimes that's formal therapy, and sometimes that might be some type of counseling that's offered through your religious organization or a social organization that you're part of. So there's different types of, counseling that can occur. The other thing to think about is really key is socialization. So socialization is actually very key for both depression and for cognitive decline. Because when we engage with others at the right level, so a level that's not exhausting to us, but a level that feeds us, that interests us, that we feel like we are being heard and cared for, and that it's a very mutual interaction, that can really help to improve our overall mood. And the reason why it's also important for our cognition is that every time we have an interaction with someone, we are actually stimulating our memory center. So let's say it's the first time I'm meeting you, Sue, and I might ask you questions about like where you grew up versus where you work now. And as we talk about that and maybe where you love to travel, I am learning new information. So it's engaging my brain. It's probably going to elevate my mood at least a little bit, if not a lot. And it's certainly going to stimulate my memory center because I now have the job of paying attention to you, activating my memory, and hopefully filing away a few key pieces of information about you. So socialization is very important. In addition, we highly recommend mindfulness or meditation. That might be through yoga or through an app, or it might be through a formal class. But what meditation has been linked to is improving overall attention and concentration, which is often affected in depression, but it also has been linked to lowering inflammation. And inflammation tends to go up with depression and or cognitive decline. So meditation is really a great form of brain training, of emotional training that can be very beneficial to us. We, of course, always encourage exercise, getting out in the community and volunteering. I highly recommend thinking about a new hobby. It should be something enjoyable, stimulating, interesting, but not stressful. So one of my favorite recommendations is Mahjong because Mahjong is social. It is also really good for the mind and it allows us to learn something new. And you can do a little bit of it or a lot of it. And then, of course, as a neuropsychologist and as someone who has created many different types of cognitive training programs over the past 3 decades, I highly recommend that you think about cognitive training online or in a local class, which might be virtual or in person, because that's also another chance to feel as if you are taking control of your mood and your cognition. And when we have that sort of self-direction, we tend to improve in our overall outlook about our life.
Right. So instead of being passive about, your mood and your state, you just take some action in some direction will help. But in those specific directions you mentioned, socialization and um,
Absolutely.
yeah, that would be that's anything that stimulates the brain, it sounds like, is going to help with depression,
It
right?
is
Yeah.
absolutely because that emotional center and memory center and language are all really tightly connected and linked together, right?
Hmm.
So think about like if we want to combat apathy or depression, when we become interested in something new, even just a spark, right?
Right.
Our mood tends to improve, right?
Right.
That's why people absolutely love their hobbies or love to travel or they love a good new movie, right? Because they're getting a spark. Like, oh, I'm interested in this. Now I'm investing in something that I enjoy.
Right. Right. Excellent advice. Thank you.
Yes, thank you.
I have one more question for you. Um, and this has been a more of a recent issue, I think, across the world. But how does
Yes.
loneliness and isolation affect our aging brain?
Yes. Well, I think that we saw this become a very apparent issue, right, during the pandemic. And depending upon where you lived in the country, the risk for isolation and loneliness was greater. And of course, we saw that for at least a subset of the aging population, people were very, very careful during the pandemic, but it also means that they withdrew from their social circles. And if they didn't have access to people through Zoom or other media, platforms, they may have gone days, sometimes weeks or longer without any contact, right? Especially for those who didn't have family nearby or were unpartnered, or their friends were across the country. And for some of our aging folks, of course, they also are losing their friends. So when we're experiencing isolation and loneliness, we are not receiving all that feedback that our brain and our body needs, right? Meaning that level of engagement emotionally, socially, and cognitively. And so we become very inward thinking, which, if you're a philosopher, that could be a good thing as long as it's not too much of that, right? We still need the chance to outwardly express what we are experiencing, what we're thinking, what we like, what we dislike, and also to take in that information from other people. So when we see that people have become isolated for an extended time period, we actually see that their risk for depression goes up significantly. And that level of depression can sometimes be harder to address. And we also saw that for some people, we saw that they had so little cognitive stimulation that they also were at higher risk for cognitive decline. So in my own practice, I actually experienced with some of my aging couples that if one of the partners had dementia and the other one had maybe some mild cognitive changes, their cognition got worse also because of the isolation they were experiencing when just being partners, just the two of them, or being alone and not having those outlets. So, uh, sort of like our fruits and vegetables, right? We need a lot of variety. That's really good for our brain. We know that from an antioxidant standpoint. And the same is true for stimulation, right? So sometimes it's what we enjoy reading or watching on TV, but it's also getting out and exercising, but it's also engaging with others, their lives, and sharing ours so that we can feel connected, right?
Hmm.
Connection is the key, I think, for humans to feel less depressed and to experience less cognitive changes.
Exactly right. It makes perfect sense because humans are wired to live in groups
Yeah,
and be social and collaborate and
absolutely.
move around the world together, so that
Yes,
isolation can also lead to physical problems just from you get more sedentary if you're not interacting with anybody and have no
correct.
place to go. So I think all of
Correct.
your advice is just spot on for not just only combating depression and cognitive decline, but just for living a better life, a higher quality of life.
For longevity. I mean,
Yeah,
I
for
love what you said
longevity.
about movement. And as soon as you said that, I thought about the research that shows that if we do engage with others, we are, exercising more, we're moving more, we actually have better health habits. And we're also more likely to go to the doctor and discuss any symptoms that are really important. Whereas when we're in isolation, we might just hunker down, but we don't actually address what is going on with our body or our mind.
Right, right. And one more plug for being outside, because that
Yes.
also, just being in nature has an effect on your mood and can lower the incidence of depression as well. So
I
get
love that. We call it
outside.
nature bathing, right? Is
Right.
what they call it now. And it's really true. There's actually research that shows that plants in themselves improve our mood, which I
Hmm.
love. I'm a big plant person, both inside and outside of my home and my office. And I think that there really is something to experiencing and enjoying nature. And if
Yep.
we think about nature, especially plants and animals and such, it's all about growth, right? So we get to enjoy, let's say, a rose bush blooming, right? Going from those little buds to full blooms and watching that whole process, that's a level of engagement. And
Hmm.
so nature is really important for our mood. And what I love about that recommendation, Sue, is that's the one that costs the least.
It's
It's to go
free.
outside of your home or your apartment and go enjoy a walk and enjoy nature.
Yep. Yep. Because you get more in sync with the world that way. You're part of this world,
Yes,
just the rhythms of the weather and of the seasons and of time change throughout the day. And you're a part of that. And if you're inside all the
yes.
time, you don't get to experience that rhythm, which I think is just all built into how we're meant to function.
Exactly. Well, one of
Yeah.
my recommendations that I've had for people is that most of you have a cell phone, so go out and take a walk and take different pictures of trees or leaves or flowers just for your own pleasure, just for your own collection, right? And then if you really want to be proactive in nature, one of my challenges that I had in my newsletter at Pacific Neuroscience a few months ago was take a bag with you and put on some gloves and pick up trash as you go on a walk. And it makes you feel so good when you pick up this random trash that people have left behind, and then you throw away a bag of trash or more. That can just, you're out in nature, you're making your community better. And even though it's only one trash bag at a time, it's like actually feels so good.
That is my favorite piece of advice I think I've heard in such a long time. Because it's that sense of purpose, it's a sense of
Yes,
giving back, sense of connection to your community and
yes.
nature and that's my take home message today. So
Yes. During
thank
the
you so much.
pandemic, my son asked me, "What do you want to do for Mother's Day?" And I said, "Let's go pick up trash," because it was like you couldn't go anywhere else, right? There was nothing open. And so we picked up 17 bags of trash around our neighborhood in Pasadena, California. And it felt so good. And, my partner thought I was crazy because it's like, who wants to pick up trash on Mother's Day? But it actually felt great to
Yeah.
participate and be out in the outdoors and do something that was, we could do when the pandemic
Hmm.
had just started.
I think we should do a study on that, picking up trash and lowering depression.
I think so. I think we'd actually have some really positive results.
I think so too. That'll be our next paper.
Yes, that would be lovely.
Oh, well, Dr. Miller, thank you so much for being here today. This has really been a wonderful conversation and very helpful, I'm sure, to all of our listeners. So thanks
Oh, thank
again.
you for having me, and it was really great to be here with you, and I look forward to future collaboration with you, Sue.
Thanks so much. Take care.